If I focus on the advanced group, yes, there is a current trial open, APEX, Cogent Biosciences, using Bezuclastinib. There's been some preliminary data shown at EHA 2020 showing promise. The drug is looking good. It's an oral potent c-KIT inhibitor. Slight difference from avapritinib is it doesn't cross the blood-brain barrier. And I think excited to see what the data produces over the next couple of years for this particular drug. Combination therapy, looking at the most common AHN is CMML, possibly looking at trials, looking at a combination of azacitidine or an HMA inhibitor with avapritinib or TKI, seeing if we can manage both diseases and see where patients may go to transplant. So that's in the advanced arena. Got to mention that in the indolent SM arena, there was fantastic data presented on avapritinib at a much lower dose of 25 milligrams once daily, reaching its endpoints in the PIONEER trial. And bearing in mind that indolent SM patients make up 60 to 70% of patients with SM, and a few of them can have a really poor quality of life, I think we've got exciting times ahead to see if we can make a difference in patients with advanced disease with their overall survival and their quality of life, but with patients with very symptomatic disease with indolent SM in improving their quality of life.